Hi, I'm Matt. I'm from Chester Pride. I'm the project coordinator. I work on a number of things like our social support groups we gather around, but today I'm here to talk about HIV awareness and HIV testing ahead of World AIDS Day on the 1st of December. I'm here at the Fountain Clinic here in Chester with the Sexual Health Service to just go through a basic HIV test, basic questions about HIV awareness, PrEP and other sexual health issues, just to try and break some of the stigma and show just how easy it is to get tested.
Hi there, Matt. Come and have a seat.
Hi there.
How can I help today?
I'm here to have a HIV test done.
Yeah, great, excellent. So glad you've come into clinic today.
Yeah.
So obviously we'll do a test from the clinic, but we also have postal kits as well. So from the kits at home, there's a website called the sexualhealthhub.co.uk, and you can actually order a kit from home. So it includes things like chlamydia and gonorrhea tests and swabs that you can do, but also a pinprick test for collecting blood in this vial, and that gets sent off to the labs to do a blood test. But because you've come to the clinic today, which is fantastic, we're going to do a venous sample. So it's taking blood just from one of your veins.
So Dr. Kang, I was wondering what the process would be for starting PrEP here at the clinic.
PrEP is pre-exposure prophylaxis, and it's for what we call HIV prevention. It's a drug that you can take to stop you getting HIV, and it actually contains what we call antiretroviral medication. So 2 antiretrovirals are combined in this pill, and it's a pill that you can take either every day or around the time of sex, which is known as on-demand PrEP. So here at the clinic today, what we can do is go through that with you. We need to do some baseline testing. So that includes a full screen for you with chlamydia, gonorrhea, HIV and syphilis testing, also hepatitis B testing, checking your kidney function just as a baseline. And once those results are back, we can commence you on PrEP from the clinic. It's now available on the NHS for free through sexual health clinics. So it's great that you're thinking about that, and let's definitely get you started on that.
So I've heard about PEP. How does that differ from PrEP?
So PEP is post-exposure prophylaxis. So it's something that's taken after a risk of HIV transmission that's occurred, whereas PrEP is pre-exposure prophylaxis. So if you imagine PrEP is kind of preparing, whereas PEP is something to think about maybe after something's happened where you're worried about the risk of HIV. So for example, if you had a condom break or unprotected sex and you were worried, where you didn't know the status of your partner, or they disclosed that they may be positive and not on effective treatment, you can come and talk to us, ideally within 24 hours, but up to 72 hours, to start some medication to stop you getting HIV. That medication is a 28-day course of treatment, and it involves 2 different drugs. So one is called Truvada and the other is Valtegravir. And those drugs must be taken for 28 days, and we would go through all of obviously the side effects and look at any of the medications you're on. And during that time it's important, because we're excluding HIV infection, trying to prevent you getting HIV infection, that you don't have any unprotected sex or any kind of further risk. Following your completion of PEP, which would be for 28 days, we then do a HIV test at 45 days afterwards. That's the window period for testing, which will tell us and give us the information whether or not you've come across the infection following that exposure. So it's really good to know about both, and PEP is not quite as effective, whereas PrEP in the studies is really effective. It's all about preparing, if you're thinking about it, preparing for sex. So that's the difference between the two. Does that answer your question?
Yeah, that's great, Doctor. Thanks for telling me. What sort of advice would you give for people that weren't cisgendered men like myself?
That's such an important point that you raised, actually. So PrEP, in terms of taking it every day, has only been monitored in terms of rectal tissue. So if you were only having anal sex, you can take PrEP on either a daily or on-demand basis. Both options are available for you. However, if you have vaginal tissue or you're having frontal sex, then you can only take PrEP every day. It's not studied in terms of on-demand dosing. It's not at therapeutic levels for you to rely on it in that way. The difference in terms of what we call lead-in times as well is taking it for the 7 days for the drug level to be effective, for you to start relying on it as a HIV prevention method. However, if it's on-demand dosing, but we're saying specifically for anal sex only, it's taking a double dose, so 2 tablets, 2 to 24 hours before the episode of sex, and then whenever the sex has occurred, another dose at 24 hours and another at 48 hours afterwards. So important to cover that episode of sex with the tail I always describe. So for example, if you were to tell me you're having sex on Friday night, it's the double dose before Friday night, then another dose. So say sex happens on Friday, take another dose on the Saturday and another dose on the Sunday. If, however, you told me you're having sex maybe all weekend, but you wanted to do it from an on-demand basis, it's a double dose on the Friday and then the Saturday. Say if you had sex on the Saturday, and another dose on Sunday, say you had sex on Sunday, but then another dose on Monday and Tuesday to make sure you cover that episode of sex.
So is PrEP 100% effective, doctor, or would I need to take other precautions?
Great. So in terms of PrEP, so we had something called the IMPACT trial. That's how we knew about actually demand for PrEP. And it was a trial done in the UK for over 3 years, looking at patients that went on to PrEP, obviously the regular testing that was required, and overall during that time it completely reduced risk of HIV infection. However, it's only as good as you take it. So if you're good at taking it as we've described, then your efficacy from it is going to be much higher. However, there is a scenario where PrEP isn't effective, and that is if you were unlucky enough to come across somebody that was HIV positive, not on treatment, so they had what we call a detectable HIV viral load, and they had a resistant form of the virus. So for that very scenario, we always say it's really important to talk about testing with partners, so having those kind of open discussions with partners. When did you last get tested? Have you had a recent HIV test? Or even if they are HIV positive, if they've had a recent undetectable HIV viral load, they can't pass on the virus. So there's the U=U campaign. If you're undetectable, you're untransmittable, you cannot pass on the virus. So it's about being educated, I guess, about PrEP, how it works, how you take it, and being really mindful that this is only HIV prevention. So we still advocate the importance of using condoms. And because it is only HIV prevention, it doesn't protect against things like syphilis, chlamydia, gonorrhea, herpes. And therefore, it's so important that you have regular testing too. So in order for us to prescribe PrEP safely, we ask that you come to clinic every 3 months for a HIV test, but also a full screen at that point. So that's kind of how we would talk about PrEP and kind of how effective it is. Does that answer your question?
Yeah, that's great, Dr. Kang. Thank you for taking the time to speak to us here at Pride today about HIV testing in the run-up to World AIDS Day.
Hi Matt, how are you?
Hi there.
My name's Aldo, I'm one of the nurses here. I'm going to take some blood from you today. Okay, so the blood I'm going to take is for HIV and also for hepatitis and syphilis. Okay, there's a window period of 45 days, so this is an historic test of minus 45 days, if that makes sense.
Yeah.
So if you got HIV yesterday and were previously negative, then this won't show up today. So it's minus 45 days.
Okay.
Okay. Any questions?
How often would you recommend I get tested?
That's a really good question. We would recommend a test when you have a change of partner or every 3 months if you're on PrEP.
Okay, brilliant.
But we're here for you, if you want to talk about anything in relation to sexual health, not just STIs.
Yeah.
Okay. Cool. I'm just going to pop this on your arm. Don't do it too tightly. Cool. Excellent. Bear with me. Little scratch. You're doing very well, okay? Nearly finished. Getting ready for World AIDS Day.
Yeah, for our vigil that we're hosting.
Is that in Chester?
Yeah, it's on St John Street at the Methodist Centre.
Is it? Fantastic. I think you do a great job, I really do. Can you just press out there? Brilliant, thank you. Right, are you allergic to plasters?
No.
I'll pop them on, okay? So, hopefully, that's you done. Yeah?
Yeah.
And we'll text you the results in about a week.
Okay.
That's brilliant that you just had your HIV test. It's quick and simple, isn't it?
Yeah,
That?
really
So
easy.
that's what we'd recommend, obviously, for our, anybody that in the Cheshire West or Chester area that wishes to come in for a HIV test. It's really straightforward. So on World AIDS Day, which is the Wednesday, the 1st of December, we're going to have specific appointments for people to come in and have HIV testing done. And obviously from your experience, I hope you can advocate that it was nice and straightforward.
Yeah, it was so easy to get done. I'd definitely recommend the clinics that are going to be available on World AIDS Day, and they're going to be promoted on our website.
Brill. And in terms of the results, so what we do is we send you a text message, and the turnaround time is about 10 working days. If there's a problem with the test, we phone you actually, so we discuss that. If, however, it's negative, we send you a message with the negative result. So it's a really quick turnaround time as well.
Yeah.
And did you want to ask about other things? Because in the clinic we do other things like vaccinations from sort of general sexual health promotion. So should we talk a little bit about that?
Yeah, let's talk about the vaccinations and any of the other services available here.
Brilliant. So we do vaccinations for hepatitis A, hepatitis B, but also HPV. So hepatitis A and B is to stop a certain infection, a viral infection that affects the liver, and we've got good vaccinations for that. HPV is a vaccine that we have in combination for the HPV types, as they were, that cover for warts, but also for oral and anal cancers. So we would advise on men who have sex with men under the age of 45 who have not been vaccinated for HPV to contact the clinic so that we can get that vaccination organised for them. It's a really effective vaccine, and we have that in stock and available.
How many vaccines are part of the programme then?
For HPV, yeah, it's only 3 actually. So it's 1 at the start, 1 a month later, and 1 at either 4 or 6 months. And that pretty much offers lifelong protection. With Hep A, it's just 2 vaccines, and Hep B, it's 3 vaccines. And then in terms of anybody that's at risk of pregnancy, we do contraception as well. We've got all different methods of contraception available in the clinic. So it's really important you come in for a consultation so we can discuss what's tailored perhaps for yourself. We have pills, injections, coils, implants, there's a whole array of contraception. Every person is different. It's about finding the right method that sort of works for you. We also do cervical smears here, so we really encourage anybody that would like a smear test to please book in. We can arrange that for you here. And we obviously try and address all your sexual health needs, as it were, when coming into the clinic.
In terms of cervical smears, who would you recommend them for? Obviously, I know like cisgendered women, but in terms of trans people, would you recommend it for them as well?
Yeah, so anybody that has a cervix after the age of 25 as part of the screening programme must have a smear every 3 years. That's what we would recommend. We're very skilled in the service because we do a lot of speculum examinations. So if you're worried about that or worried about the sort of technical ability, we have a wealth of experience in completing that. In terms of if you're a woman living with HIV, it's slightly different. We would advise annual smears, so slight sort of difference in care. But yes, we would anybody with a cervix we would recommend to have cervical smear testing regularly according to the national programme.
Okay. So obviously we've talked about me starting PrEP. What would the treatment involve?
Yeah, so here's a box of tablets that we've got, so you can see it's quite discreet. The tablets, it's just the 1 tablet that we discussed. We would give you 3 months actually on the first visit to clinic. So as long as we've got that negative HIV test, we've done those baseline screening tests that I mentioned with the kidney function, we would go ahead and give 3 months of PrEP and then advise that you come in every 3 months for that. If you were using it on an on-demand basis, we might tailor the kind of dose and supply that you need, but the drugs are exactly the same. So this is what it looks like. It's really sort of straightforward. And as I said, sort of small boxes, which are quite easy to sort of carry around.
So that was obviously really easy to come and get tested, and the test was really quick and simple. And obviously here at Chester Pride we've organised this today to talk about our testing events that are coming up on World AIDS Day. Could you tell us more about that?
So it's great that we've come together to actually have an event on World AIDS Day for HIV testing. On that day specifically, we've got clinics booked both in the morning and the afternoon for anybody that would like a HIV test. that they can contact our line and book in for a HIV test. Because we're obviously a sexual health service, we will do any of their further screening that they would need on that day, but that's the specific event. So if you'd like a HIV test on World AIDS Day, we're doing the testing here at Cheshire West and Chester at the Fountains in Chester.